Hi, I'm Brittany, and I'll be the nurse today.
Hi, I'm Amar, and I'm going to be the narrator slash doctor.
Hi, I'm Sarah, and I'm going to be the patient today.
Introduction. So, patient is coughing and wheezing and decides to go to urgent care. Patient goes to urgent care where he is being assessed by the nurse.
Hello there, I'm Nurse Brittany. It looks like you're having some difficulty breathing today. How can I assist you?
Yeah, I've been coughing a lot, and it feels like there's this wheezing sound when I'm breathing. It's been going on for a while, and I thought it would be a good idea to get it checked out.
I'm glad you came in. Let's start by finding out more about your symptoms. How long have you been experiencing this cough and wheezing, and have you noticed any specific triggers or patterns?
It's been a few days, and I'm not sure what triggers it. It just seems to happen randomly. I'll be walking outside, and I'll start experiencing shortness of breath.
Oh, okay. Thank you for sharing that. Have you ever had a diagnosis of asthma or any respiratory conditions in the past?
No, nothing like that. I've never experienced this before.
All right, let's check your vital signs and get you a bit more information and do a quick assessment and get some information regarding the issue.
Okay.
Do you have any known allergies?
Not that I know of.
Have you moved to a different area recently?
Yeah, I did just move to a more industrial area.
Okay. Are you physically active? And if you are, do you experience any respiratory symptoms while working out?
I have started going to the gym more often because I wanted to live a healthier lifestyle, and I do notice that I begin to have shortness of breath during and after exercise.
Do you smoke?
I don't smoke cigarettes, but I just started vaping recently. My friend introduced it to me.
The nurse proceeds to check vital signs, including heart rate, respiratory rate, and oxygen saturation. For respiratory rate, it's 26 breaths per minute, heart rate 110 beats per minute, blood pressure 140 over 90, oxygen saturation is 93% on room air.
I do notice that your oxygen is on the lower end. I'm going to listen to your lungs to get a better understanding of what might be going on. Please take some deep breaths for me.
Is everything okay?
I'm hearing some wheezing, which is a high pitched whistling sound that occurs during exhalation, but also can occur during inhalation. It's important for us to figure out the cause. I'll recommend some tests, including a pulmonary function test, to better understand your lung function.
Okay.
Okay, and now I will be playing the doctor.
Hello again, Sarah. This is Dr. Amar, and they'll go over your diagnosis and answer any questions you may have.
Hello, Sarah. I've reviewed your assessments and Nurse Brittany has shared some details with me. Let's talk about what's been going on and what we found.
Sure, doctor. I've been really worried about this coughing and difficulty breathing that I've been experiencing.
I completely understand, Sarah. Based on your symptoms and the assessments we've conducted, I can tell you that you have asthma.
Okay, well, what does that mean exactly?
Asthma is a long term condition that affects your lungs and breathing. Asthma causes your airways to become inflamed and narrow, making it difficult for you to get air in and out. It also causes the muscles around your lungs to tighten, constricting your lungs further. This is called bronchospasm. Lastly, the glands in your lungs may secrete a thick mucus, which also blocks your airways. About 1 in 13 people in the US have asthma, and while there's no cure for asthma, we have many resources to help get your asthma under control. We'll work together and make a plan to help manage your asthma.
Okay, thank you. Do you know what would have caused me to have an asthma attack?
These types of responses can be caused by allergies, exercise, viral infections, or cold air. We call these asthma triggers. Asthma triggers initiate the release of IgE antibodies, which start an immune response and cause your airways and muscles to tighten. Examples of substances that can cause an asthma attack are tobacco smoke, dust, chemicals, and pollen. Part of your management plan will be avoiding these triggers because your immune system overreacts to them.
Since you have moved to a more industrialized part of town, could explain the new onset of symptoms. Industrial areas are usually have many different warehouses and factories, and industrial areas are often associated with higher levels of air pollution. So it might be helpful to wear a mask when stepping out in your area. I would also recommend that you avoid smoking and vaping because you are inhaling substances that can irritate and potentially harm the respiratory system.
Okay, yeah, that definitely makes sense. So is asthma just a condition where I cough a lot and feel shortness of breath?
So, asthma can vary depending on the person and the circumstances. Asthma can cause wheezing, coughing, difficulty breathing, and chest tightness as well as a result of narrowed, inflamed airways. Asthma attacks can have varying degrees of severity. A particularly severe asthma attack may cause sweating and the use of extra muscles in the shoulders, chest, ribs, and neck to maximize the amount of air being brought into the lungs, as well the inability to speak a full sentence or even a few words without needing to pause. If your asthma attack is not relieved by your prescribed medications, it is vital that you seek medical attention immediately. Other signs that medical attention is needed is when your lips or fingernails turn blue. This is a sign that your body is not receiving enough oxygen. Improper oxygen levels may also cause you to feel confused, agitated, and cause difficulty concentrating because your brain needs a certain level of oxygen to properly function.
Okay, yeah, that definitely makes sense. What medication will I have to take?
For asthma, there's a variety of medications available, such as bronchodilators, anti inflammatories, combination medications, anticholinergics, biologics, and antibiotics. Using your medication correctly is very important because if we don't manage your asthma correctly, the symptoms may keep worsening. Bronchodilators work by relaxing the muscles surrounding your airways. This opens the airways up and makes it easier to breathe. You may be prescribed a short acting bronchodilator with immediate effects or a long acting bronchodilator, which helps for a longer period of time, but doesn't work immediately. Examples of bronchodilators that may be prescribed to you include albuterol, lavalbuterol, and perabuterol. Anti inflammatories reduce swelling and mucus production in the lungs, making it easier to breathe. You may hear these called corticosteroids. These are inhaled medications, and you should always rinse your mouth out with water after using them. They are always taken after bronchodilators. Bronchodilators open up passages so that the steroids can penetrate better. Combination drugs are both bronchodilators and steroids. Anticholinergics prevent the muscles tightening around the airway. These are usually taken for long term control and are used in combination with bronchodilators and corticosteroids. Biologics are a medication we may consider later if your asthma is not controlled with bronchodilators and corticosteroids. These medications are given as shots or IVs. For you, I will be prescribing you a meter dose inhaler.
Okay, I'm going to go over how to use an inhaler with you. Using an inhaler correctly is vital for effective asthma management. So first, we want to take our inhaler and we want to start by shaking it to mix the medication. And then you're going to hold it upright and you're going to exhale gently and then inhale slowly and deeply through your mouth while you're pressing down the canister. So exhale and then inhale, and you would press down on the button. You have to coordinate inhaling and activating the inhaler to ensure proper delivery into your lungs. Then you're going to hold your breath for about 10 seconds and exhale slowly. Repeat multiple times if multiple puffs are prescribed. Using a spacer can also enhance your medication delivery, and we're going to be doing this daily to maintain your asthma symptoms.
Okay, yeah, I can definitely do that. Will this disease affect my entire body?
Asthma is a condition that mainly affects your breathing. It causes the tubes in your lungs, called bronchial tubes, to become inflamed and narrower, making it harder to breathe. This leads to symptoms like wheezing, shortness of breath, and coughing. While the main impact is on your ability to breathe, asthma can also affect other parts of the body. During an asthma attack, your heart may work harder and stress hormones can be released. The muscles you use to breathe might get tired and the immune system can become more active, causing ongoing inflammation. In severe cases, asthma attacks can even lead to dehydration. So while asthma primarily involves your lungs and breathing, it can have some effects on your heart, muscles, immune system, and other body systems. Managing your asthma usually involves using medication to reduce inflammation, open up the airways, and identify and avoid triggers to keep systems under control. Regular checkups with a doctor are essential to make sure your treatment plan is working well and also to address any concerns you may have. Do you have any questions for us?
No, I think I have a good understanding now. Thank you for explaining that.
Okay, good. Just remember you can always reach out to me if you have any more questions. Asthma is very manageable if we get ahead of your symptoms, and so we will send you home with medication information packets. I'll put my number on there for you if you need to reach out.
Okay, thank you.
Thank you, Sarah. Reach out if you have any questions.
Thank you, I will.